So in this assessment, I will cover the case of Joe. So we have to do the pre-exercise health screening procedure. Knee joint. John is complaining that his knees ache when standing for long periods. Little experience physical conditioning. He works as a long-distance lorry driver 5 days per week. He has no condition or injuries. Bones of the knee. There are 4 bones around the knee: the thigh bone, femur, the shin bone, tibia, inna patella, and the fibula. Femur. Thigh bone, the longest bone in the body. The round knobs at the end of the bone near the knee are called condyles. Between the knee joint, the end of the femur is covered in hyaline articular cartilage. Tibia, shin bone, runs from the knee to the ankle. The top of the tibia is made up of 2 plates or flat surfaces, which are covered in articular cartilage within the knee joint. Patella, kneecap, a semi-flat triangular bone that is able to move at the end as the knee bends. Its main function is to increase the force generated by the quadricep muscle. Fibula, a long thin bone in the lower leg on the lateral side, which runs alongside the tibia from the knee to the ankle. Ligaments in the knee. Ligaments are strong bones that are not particularly flexible. The function of ligament is to attach bones to the bones and to help keep them stable. So we have the medial collateral ligament, the tibia collateral ligament. Attach the medial side of the femur to the medial side of the tibia and limit sideways motion of your knee. Lateral collateral ligament. The fibula collateral ligament attach the lateral side of the femur to the lateral side of the fibula and also limit sideways motion of your knee. Anterior cruciate ligament, ACL. Attach the tibia and femur is located deep inside the knee and in front of the posterior cruciate ligament. Posterior cruciate ligament. It attaches the tibia and the femur. It lies behind the anterior cruciate ligament. It mainly limits backward motion of the tibia relative to the femur. Patellar ligament or tendon attaches the kneecap to the tibia. It is less of the ligament and actually a continuation of the quadriceps tendon. Joint capsule, a thick fibrous structure that wraps around the knee joint. Inside the capsule is the synovial membrane, which is lined by the synovium as of tissue structure that secretes synovial fluid, the lubricant of the knee. Cartilage of the knee. There are many types of cartilage in our body, each with a slightly different function. For instance, the medial and lateral meniscus are made up of fibrocartilage, which make them strong and rubbery and able to add additional stability to the knee. On the other hand, like bones of most joints, the end of the femur and tibia and the undersurface of the patella are covered in the hyaline cartilage. Hyaline cartilage is both flexible and slippery. So on the cartilage of the knee we have the lateral meniscus, medial meniscus, articular cartilage, articular cartilage. So we have the medial meniscus and lateral meniscus. In the muscle of the knee we have the quadriceps femoris, include the vastus lateralis, vastus intermedius, vastus medialis, rectus femoris. We have sartorius, gracilis, hamstring located on the posterior backside thigh. Bends the knee include the following 3 muscles: semimembranosus, semitendinosus, biceps femoris, gastrocnemius, pes anserinus. Movements. The main movements in the knee joint are flexion and extension of the knee in the sagittal plane. It's also allowed limited medial rotation in a flexed position and in the last stage of extension, as well as a lateral rotation when unlocking and flexing the knee. Unlike the elbow joint, the knee joint is not a true hinge since it has rotational component, an accessory motion that accompanies flexion and extension. Hence, it is termed as a modified hinge joint. The degree of possible knee flexion depends on the position of the hip joint and whether the movement is active or passive. When the hip is flexed, a maximum degree of flexion of 140 degrees is achievable in the knee joint, whereas an extended hip allows for only 120 degrees, an accessory motion that accompanies flexion and extension. Hence, is termed as a modified hinge joint. The lever system. Lever system has two main functions. Firstly, to increase the resistance that a given force can move, and secondly, to increase the speed at which a body moves. In addition, different types allow different range of movement. First-class lever system. In a first-class lever, the fulcrum is the mirror component and lies between the effort and load. Example of a first-class lever in the body are rated as a few exercises utilizes a first-class lever system or torque extension straining at the elbow is one example. Second-class lever system. In a second-class lever system, the load in the middle component lies between the fulcrum and the effort. Exercise involving plantar flexion and the ankle are second-class lever systems such as calf raise or when jumping upwards whilst performing a layup basketball. Third-class lever system. The majority of movements in the human body are classified as a third-class lever system. In a third-class lever system, the effort is the middle component and lies between the fulcrum and load. There are many examples of third-class lever systems, including both flexion and extension of the knee joint. These movements are involving in running, jumping, and kicking. Movements to strengthen, mobilize, loosen, and stabilize. The following tips may help prevent common knee injuries. For example, warm up by walking and stretching gently before and after playing a sport or doing exercise. Keep the leg muscle strong by using stairs, riding a stationary bicycle, or working out with weights. Avoid sudden change in the intensity of exercise. Replace worn-out shoes. Choose one that fits properly and provide good traction. Maintain a healthy weight to avoid added pressure on the knees. Always wear a seat belt. Use knee guard in sport when knees get injury. So safety consideration at this joint. So I reckon first to see a doctor if we have some chronic conditions. So it will allow us to work out with the client. Avoid heavy weights when we have a knee joint is a good way to prevent that the joint with the days make it worse. Warm up before to go to the training is a good action to prevent injuries. Always stretch before and after to go to train or to the gym. And the type of the kind of intensity depends of the joint. I mean of the pain of the joint. So it's better to start in a I mean, the intensity for me I reckon to train in a moderate level. That's it.